Harold Shipman, known as Dr. Death, is one of the most prolific serial killers in history, responsible for the deaths of hundreds of his patients. His case shocked the world and raised serious questions about trust in the medical profession. Harold Shipman was born in 1946 in Nottingham, England. From an early age, he was known to be intelligent and ambitious. After witnessing his mother's death from cancer and observing the effects of morphine on her pain, Shipman became fascinated with medicine. This experience likely influenced his future career as a doctor, but it also planted the seeds for something far more sinister. Shipman graduated from Leeds School of Medicine in 1970 and began working as a general practitioner. Initially, he appeared to be a caring and dedicated doctor, well-liked by his patients. However, behind this facade, Shipman was hiding a dark secret. He was addicted to pethidine, a powerful painkiller. His addiction led to his first brush with the law in 1975, when he was caught forging prescriptions to obtain the drug for himself. Shipman was fined and briefly entered a rehabilitation program, but this early warning sign went largely unnoticed, allowing him to continue practicing medicine. By the late 1970s, Shipman had moved to Hyde, a small town near Manchester, where he established a thriving medical practice. It was here that his killing spree began in earnest. Shipman preyed on some of the most vulnerable members of society, elderly women who trusted him implicitly. His method was chillingly simple. He would administer lethal doses of diamorphine, a powerful opioid, to his patients, often while making it appear as though they had died of natural causes. Over the years, Shipman killed with impunity. He would often sign the death certificates himself, attributing the deaths to old age or natural causes, and then encourage the families to cremate the bodies, effectively destroying any evidence. His position as a trusted doctor allowed him to carry out these murders without raising suspicion for many years. It wasn't until 1998 that Shipman's crimes began to unravel. The family of Kathleen Grundy, an 81-year-old woman who had been one of Shipman's patients, became suspicious after she died suddenly. To their shock, they discovered that her will had been altered to leave her entire estate to Shipman, a change that Kathleen's daughter knew her mother would never have made. The family reported their concerns to the police, who launched an investigation. When Kathleen Grundy's body was exhumed, toxicology tests revealed lethal levels of diamorphine in her system, confirming the family's worst fears. The police began to suspect that Kathleen Grundy was not Shipman's only victim. A deeper investigation followed, focusing on the unusually high number of deaths among Shipman's patients and the frequency with which he had signed their death certificates. In total, the investigation identified over 200 deaths that occurred under suspicious circumstances during Shipman's tenure as a doctor. The true number of his victims, however, is believed to be much higher, possibly as many as 250. Shipman was arrested in September 1998, and the trial that followed became one of the most infamous in British legal history. During the trial, Shipman maintained his innocence, despite overwhelming evidence against him. The prosecution presented a chilling case showing that Shipman had methodically killed his patients over the course of 2 decades, abusing the trust that his position as a doctor afforded him. The jury found him guilty of 15 counts of murder and 1 count of forgery related to the altered will of Kathleen Grundy. In January 2000, Shipman was sentenced to life imprisonment without the possibility of parole. However, even after his conviction, questions remained. How could a doctor, someone entrusted with the care and well-being of others, carry out such heinous acts for so long without being caught? The case led to a public inquiry, known as the Shipman Inquiry, which resulted in significant changes to medical practices and the monitoring of doctors in the UK. On January 13, 2004, Harold Shipman was found dead in his prison cell, having taken his own life. His death brought little comfort to the families of his victims, who were left with the pain and trauma of losing their loved ones at the hands of a man they had trusted. Thank you for watching. If you found this video informative, leave a like and subscribe so you don't miss our next videos.